Madam Speaker, I rise today because American moms are dying tragically. The majority of these deaths are entirely preventable, as we've heard. This weekend is Mother's Day, the day when we celebrate our mothers, grandmothers, aunts, stepmothers, and all the women who love and nurture us. There will be brunches and mimosas, cards and flowers, backyard barbecues and fancy dinners. It might just be a quick call saying, "Hey, Mom, I love you." But each year, more than 700 American kids begin their lives without moms. Nearly 100 of these deaths are in my state of Illinois. These kids will never know their moms or celebrate a Mother's Day with her because of America's embarrassing maternal mortality crisis. Perhaps most shocking of all, a recent CDC report shows that 60% of these deaths are entirely preventable. While hundreds die, thousands suffer severe health complications that can endanger their lives and limit mothers' ability to care for their families. Recently, Serena Williams and Beyoncé have boldly spoken out about their personal experiences with these terrifying complications. As the mother and stepmother of adult daughters, it worries me that it will be more dangerous for them to have a baby today than it was for me to have them 20 years ago. On nearly every health issue, death rates have declined, except for pregnancy and birth-related deaths. In fact, America is the only developed nation where the number of women dying continues to grow. We can and must do better because all mamas deserve the chance to be mamas. So what can be done? Last year, Congress came together in a moment of bipartisanship to pass the Preventing Maternal Death, thanks to the leadership of Congresswoman Herrera Butler and Senator Heitkamp. This law will standardize data and reporting so we have a clearer picture of this crisis. Building on this bipartisan progress, I've proposed a comprehensive multi-pronged approach called the Mothers and Offspring Mortality and Morbidity Awareness Act, or simply the Mommas Act. It starts by expanding what's working. It builds on last year's work to further standardize data and reporting. It also takes the highly successful Alliance for Innovation on Maternal Health program called the AIM program, developed by our nation's obstetricians and gynecologists, and grows it. AIM's emergency protocols and best shared practices are already saving lives in hundreds of U.S. hospitals. The Mommas Act would leverage federal resources and publications to grow this proven program. It also uses another proven strategy to prevent future deaths: mortality review committees. These committees examine every tragic death in great detail to prevent further ones. When the city of Philadelphia established one, it cut the number of deaths by 75% in just 1 year. Imagine what we could do with a nationwide committee. The Mommas Act also addresses a bizarre gap in current law that prevents many mothers from seeing their doctor. We know that 1/3 of deaths occur after giving birth. Right now, moms on Medicaid lose their coverages 60 days after giving birth, but it takes a woman's body a full year to recover. More than 70% of moms will have some complications within a year of giving birth. These mothers should be able to see their doctors and get the care they need. While we are seeing approximately the same rate of maternal deaths, regardless of women's income, education level, or other demographics, the recent CDC report shows that Black mothers and Indian American and Native Alaskan mothers are dying at more than 3 times the rate of white mothers. In my home state of Illinois, that disparity climbs to 6 times more likely to die for Black moms. My bill directly addresses this disparity by pushing for culturally competent care through the care continuum. As you celebrate Mother's Day, I hope my colleagues will join me in working to ensure that everyone gets a chance to know a mother's warm love and affection. We can prevent mothers from dying. We know how. The question is, do we have the will?